The greatest need for crowdfunding manifests in the lives of millions of sick people, especially in developing countries. According to a 2018 study published in the British Medical Journal in India by the Public Health Foundation, out of pocket health expenses drove over 38 million Indians into poverty. So, countless innocent lives that could otherwise have been saved are lost because people can't afford their treatments. While a universal access to healthcare would solve this problem, unfortunately, we are far from that goal. At the same time, medical crowdfunding has emerged as an alternate method of financing healthcare. In India, where healthcare finance is a cause of concern, medical crowdfunding has become a primary source of financial aid, especially in cases of medical emergencies. For instance, Milap, one of the top crowdfunding platforms in India, raised over 160 crores for healthcare related campaigns in 2020. Medical crowdfunding in India has helped fund thousands of liver transplants, heart surgeries, cancer treatments, kidney transplants, and NICU treatments. And in many ways, medical crowdfunding has acted as a bandage to patch the gaps that make healthcare in India inaccessible or unaffordable for a lot of people. In India, thousands of NGOs collaborated with online crowdfunding platforms to raise funds during the pandemic. Milap, one of the oldest crowdfunding platforms in India, raised over 100 crores with the help of 250,000 donors for over 10,000 crowdfunding campaigns. Keto's microsite dedicated to COVID-19 relief also raised over 100 crores for 4,200 campaigns with the support of 120,000 donors. Similarly, Give India, an online donation platform, raised over 120 crores with the help of 350,000 donors and 60 plus CSR partners to help over 200 NGOs fight the pandemic. There was also a dire shortage of PPE kits in hospitals in India during the pandemic. And one of the most successful initiatives to combat the shortage was started by Milap and the Praveen Agarwal Foundation, which addressed the huge demand and supply gap of PPE kits across the country by identifying the need at the unitary level. Every year, millions of people start crowdfunding campaigns to fund their medical expenses. This makes medical crowdfunding one of the most popular donation-based crowdfunding categories, with 27% of crowdfunding campaigns worldwide being initiated to cover medical expenses. And while it's hard to estimate the overall fundraising volumes, we can get a fair idea if we look at the numbers from India's top two crowdfunding platforms, Keto and Milap. Together, these platforms raised over 1,000 crores for healthcare-related campaigns in the last 5 years, with a growth rate that doubles almost every year. Over 1,200 medical campaigns are started on Milap every month, with a 3x growth per year on average. Keto, on the other hand, hosts around 2,000 medical fundraisers per month and has seen a constant growth of 50% compounded annual growth rate in the last 5 years. So, all in all, we can say that the medical crowdfunding industry in India is a booming industry, and its growth is bound to proliferate in the near future. When I was pursuing my bachelor's in quantitative economics and econometric analysis from the University of Rochester in New York, I had the opportunity to witness firsthand how crowdfunding was at the forefront of empowering socio-political and economic change in the US. Candidates like Bernie Sanders and Alexandria Ocasio-Cortez crowdfunded millions of dollars to run their campaigns. Entrepreneurs raised thousands of dollars for their revolutionary products. And this intrigue stayed with me. When I came back to India and started working as a strategist for Keto, I saw that donation-based crowdfunding was used by so many people to fund their medical treatments or raise money to help their communities. And seeing the tremendous potential of crowdfunding in particular was inspiring. So together with my colleague Ravina Barnes, I decided to write Crowdfunding, the Story of People, the first book on the social potential and impact of crowdfunding in India. And one of the major themes in our book is the tremendous power of the crowd when it converges behind a cause. And throughout history, we can see instances where the crowd, the people have started revolutions, created entire civilizations, and achieved impossible feats. And crowdfunding, by its nature, taps into the power of the crowd. Lack of health insurance coverage, poverty, gaps in the healthcare system, absence of proper social safety nets, and rising medical costs are among the many reasons that have led to the growing significance of medical crowdfunding. At a fundamental level, medical crowdfunding seeks to turn the crowd's financial power into a safety net for those whom the public and private healthcare systems fail to support. And it's a quick and often effective funding mechanism, offering people the opportunity of providing financial assistance to those in need with just a few clicks. But it's not a replacement or an antithesis to universal healthcare. Point is, we as a society are far from achieving a perfect universal healthcare system. Even in countries where public healthcare is free, like Canada, we observe that people are still opting for medical crowdfunding owing to the long waiting period at public hospitals. And for people in need of urgent medical attention, the long waiting period can be fatal. The only option they have is to opt for private hospitals where the treatment is relatively more expensive. That's when crowdfunding can be used by people to fund their treatments. Currently, the world is on the verge of creating $1 trillion crowdfunding market. In the future, the major drivers of crowdfunding will be artificial intelligence, blockchain technology, improved internet access, and the proliferation of social media platforms. And as technology allows for better access, efficiency, and transparency, platforms will benefit from strong network effects. The value of the platforms and the industry will be enhanced as the number of campaigns and contributors grow. Such a cycle would lead to a large number of consumers and investors participating in the crowdfunding market. This exponential growth of crowdfunding hasn't gone unnoticed. In its Future of Finance report, Goldman Sachs, one of the biggest multinational investment banks globally, remarked that crowdfunding was one of the most destructive emerging finance models. The report estimated that crowdfunding could address a $1.2 trillion opportunity over time.